Healthcare worker density can be referred as the number of healthcare workers in relation to the population. It is distributed by a variety of healthcare occupations and specialists, including anesthesiologists, dentists, nurses, radiologists, and many others. The healthcare worker distribution is a distribution or percentage of health workers grouped according to specific characteristics such as gender, age, region, or even place of work. The number of pharmacies over 10,000 people in a given national or subnational area is defined as the density of pharmacies. Now, let me briefly explain about the pharmacies in the healthcare industry. The pharmacies are the world's third largest group of healthcare professionals. They are the key component of the healthcare workforce because they are highly trained and play an important role in the delivery of healthcare services. Other than selling medicines at pharmacies, they are also an essential members of the healthcare team. They are responsible for performing a variety of functions ranging from medicine procurement and supply to pharmaceutical care services, thereby ensuring the best possible treatment for patients. Since pharmacists are accessible healthcare professionals, so it is very important for us to keep an eye on how the pharmacy workforce is changing. And these changes will affect the planning and delivery of healthcare services. It is very essential for us to understand the current trends in the global pharmacy workforce and the implications of the trends on the future supply of pharmacists.
According to Human Resources for Health Country Profiles Malaysia, the density of pharmacists in Malaysia is 4.14 pharmacists per 10,000 population in 2018. Figure 1 shows that in 2018 for pharmacists, the public or private ratio was 3:2. The rapid rise in the public sector of pharmacists is owing to a significant number of graduates entering the workforce, and the regulation mandates them to serve an initial period in the public sector. From 2014, the chart shows it decreased to 2015 until 2016, and it increased back in 2017 until 2018 with 13420 number of workforce pharmacists in Malaysia. Trend in health workforce in Malaysia is shown in Figure 2. As mentioned, the trend among pharmacists indicates that the trend was consistent between 2013 and 2015, but there was a slight dip in 2014. Significant growth occurred between 2015 and 2017, and until 2018 there was little change. The best number of employees can be attained by hiring someone with training and experience. This will improve the caliber of pharmacists. Other than that, the company should post an advertisement and set a goal or requirement for everyone to meet the positions requirement in accordance with what the company needs. People with the right credential and relevant expertise may be selected and given a great opportunity. However, whoever is in charge of this department must make careful decisions, and bias is strongly discouraged because with that poor habit, the best number of employees will be reduced. In addition, not all states have the same amount of needed labor. Therefore, in order to balance the number of workers, we must make certain that we have a list of how many workers are required in urban and rural areas. For instance, a pharmacy in a hospital in Kuala Lumpur would require more personnel than one in a small town. This is due to the larger population in large city. In order to prevent overstaffing in one area, the number of vacancies must be reduced. The pharmacy should come up with a solution to balance the amount of personnel. Examples of such initiative include the Pharmacy Guild of Australia's Rural and Remote Pharmacy Workforce Development Program, which aims to enhance pharmacists' exposure to rural pharmacy practice and encourage them to work in rural area. Other than that, in Ghana, assigning certain tasks to pharmacy assistant has helped to reduce the workload placed on pharmacists. So maybe we can take an example from this city.
Now, turning to the pharmacy-related issue, the first issue is the high workload. The pharmacy professional duty has involved pharmacist dispensing to patient consultation and clinical responsibility to guarantee good patient care outcomes, such as reducing adverse drug events and medication errors. However, new community pharmacy contractual framework are thought to have increased pharmacists' workload. Too much work has been implicated in high-profile incidents of dispensing error resulting in patient harm, as well as concerns about pharmacists' well-being. A high workload, defined as the ratio of high demands to available research to meet those demands, can cause stress and frustration for pharmacists, increase the probability of medication error. According to one research, more than 2/3 of pharmacists felt their workload was excessive, and other research found a link between a high workload and poor pharmacy service quality, as seen by the inability to notice persistent errors with drug interaction and dispensing problems. The second issue is drug shortage. Drug shortage, a global issue affecting low, middle, and high-income countries, including Malaysia. In late December 2019, the coronavirus disease was found. All countries affected by the epidemic implemented various measures to reduce patient admissions through their medical wards and intensive care units, allowing their healthcare system to cope with the surge. Pharmacies are expected to participate in measures to solve this issue, such as assessing and switching to alternative generic medication, as well as switching between therapeutic choices. Pharmacists are tasked with fighting for suitable prescription while also ensuring such pharmaceutical for patients who rely on them for their primary indication. At this time, a shortage of drug can have a major effect on patient outcome. Due to change in drug concentration and potency, drug deficiency can also increase the risk of drug overdose. Certain healthcare facilities may rely on their inpatient pharmacy to compound medication that are in short supply. The last issue is pharmacists lack patient information and hard to manage patient care. It is important to have updated and correct information about the patient's current drug use to cure and prevent various medical diseases. Medicine-related problems, MRP, such as side effects, inappropriate usage, and error pose of significant risk to patient safety since they can reduce the quality of life, cause morbidity and mortality, and increase healthcare costs. Poor communication and lack information flow across service and level of care results from fragmented medication information, which can lead to potentially harmful medication error. The pharmacist cannot provide medicine if it lacks patient information, such as patient medical history. A literature review by Jans predict preventable adverse effects using a weighted analysis and report events that cause 210,000 until 400,000 deaths per year among hospital patients. Next, I will pass to the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. I am Nur SUHAILY binti Mama AMRAN, student ID 2022958761. Today I am going to talk about the ways to overcome the issues faced by the pharmacist. First and foremost, every issue and problem must have its own solution. Whether it is an easy or hard solution, every effort counts in solving one's issue. Hence, the first issue of high workload for pharmacists. This problem is known to be a common problem in workplace, and it can be solved through a few solutions. The first solution is by organizing workstations more efficiently. A big area of space in pharmaceutical setup could be tiring for pharmacists to walk back and forth from their station to others to work. Hence, their workstation should be planned out according to the flow of their work so that the energy used physically could be minimized and their focus could be on the work itself instead of moving around unnecessarily. Other than that, having a multiple workstation and rotating duty can also be a solution. Multiple workstation results in pharmacists focusing on their designated tasks at one time and not bothered by other tasks. This is completely less complex than having to do a complete procedure by oneself. When a person is bored with their task, they can simply switch their tasks and rotate their workflow at times. This action can be done by the manager of pharmaceutical department. They can reorganize their staff and workflow for a better environment. Moving on to the next issue, drug shortage. This problem that often occurs nowadays cannot be avoided as it is unexpectable. However, it can certainly be managed and solved. One of the ways is by redistributing current available stock of drugs. When there is a drug shortage, the producer in charge of evenly distributing the stock that is currently on hand across various locations and organizations. This is to ensure effective and equitable redistribution of the available quantity of shortage pharmaceuticals. Stakeholders must have a good communication and transparency with a sufficient reporting system. Additionally, drug shortage can also be prevented by reducing the wastage of it. For example, when using a small dose of drug in a bigger vial, the wasting remaining substance due to short shelf life. Patients that are needing those drugs can be gathered on a specific date and be administered to them at once. This strategy was used by anesthesia department through a double syringe technique. These ways are to be administered by the FDA and pharmacist itself to ensure that drug shortage can be prevented in the near future. The last issue is that the pharmacists are having the problem of managing patients with insufficient information. For example, many complications might arise while having any misinformations or omitted data of the patients. This can be avoided by using the electronic health record (EHR) system provided by the hospitals and management. The EHR can help pharmacists to check the consistency and the correctness of medication history while conducting systematic interviews with the patient to gain additional information. Other than that, EHR can also be used for patient evaluation and monitoring. Pharmacists usually use EHR to evaluate or work up their patients. This is by recognizing potential medication problems, analyzing medical regimens, monitoring ADEs, performing medication reconciliation, and many more tasks. This last approach is to be done by pharmacists and all the health workers in the scene to ensure all patients' needed information can be obtained and receiving wrong data can be avoided. That is all from me for the ways of overcoming the issues. Thank you.
In conclusion, the number of pharmacies and trend in the health workforce in Malaysia have increased in the recent years. The pharmacist workforce density varies greatly across countries and workforce regions, and it is generally correlated with population numbers and country-level economic indicators. The purpose of this presentation is to assess the pharmacist workforce supply and trends, as well as issues and potential solutions. The purpose of the healthcare workforce supply and trends is to maintain the quality of one's employees and to deliver health and economic prosperity. Analyzing and monitoring pharmacist workforce status is vital if workforce challenges and risks are to be addressed. Keeping healthcare professionals is very important because they contribute to establishing, enforcing policies, and keep the system running smoothly. This concludes the future supply and demand for pharmacies in pharmacies and considers the current and future sufficiency based on the number of prescriptions to determine their optimal distribution. A healthy workforce contributes to the company's success, which also helps the rate of performance decline and enhances job performance among healthcare workers.